Hi everyone, it's Mr Neel Raithatha, also known as the Wax Whisperer. Thank you for tuning into my latest video. We have a client who attended with bilateral occluding earwax. As a child, the patient informed me that they suffered from chronic ear infections and they had several grommets or ventilation tubes, as you call it in America, inserted into both eardrums due to glue ear, or what we call acute otitis media with effusion. So that's a buildup of fluid behind the eardrum due to a blocked eustachian tube. So fluid that normally accumulates behind the eardrum typically drains away out of a tube called the eustachian tube, which is a small orifice connecting the middle ear, so the cavity behind the eardrum, to the back of the nose, the nasopharynx. But if that eustachian tube gets blocked, and it can get blocked for a number of reasons, it could be that you've got an anatomically narrow eustachian tube, or there's inflammation there, or the muscles that contract to open the eustachian tube when you swallow, you eat, are quite weak and no longer as active. Inflammation, back of the nose, infection. It blocks a tube, so it's a blocked drainage pipe. Fluid can't drain away at the back of the middle ear, and it accumulates behind the eardrum. So a surgeon makes an incision into the eardrum, sucks out all the glue, the fluid, the viscous fluid, what we call glue ear, and then puts a ventilation tube so fluid can drain out of the outer ear canal that builds up behind the eardrum, as opposed to down the eustachian tube, and it also allows air to enter the space behind the eardrum. And you could see the eardrums are very opaque, very cloudy, so it's very obvious it's undergone a lot of trauma. So that's kind of calcium deposits, what we call tympanosclerosis. And it's the same with the patient's rhitis, and when we do that procedure you'll see that. So the patient's earwax was quite sticky, bit matted, so I put some olive oil earwax drops in just to lubricate it and bind this soft sticky wax together. So if you've been watching my videos, you would know that I always compare olive oil in the ear during an earwax removal procedure as the equivalent to an egg in a potato cake or fish cake recipe. It binds all the ingredients together. Also the oil helps lubricate the suction tube so it doesn't get blocked. So I'm just using a Jobson horn now, just mopping up near the entrance. All this wax that we're removing is not going to improve the patient's symptoms, but because we're on the outer cartilaginous portion, I thought I can just give it a quick tidy up wipe. You can see the eardrum's quite cloudy. There's where the umbo, where the hammer bone in the centre part, the malleus bone connects to the eardrum, it's a bit red there. So this is the patient's right ear. Again, just put some oil in right from the beginning of the procedure. It's just helped change the consistency, enables me to suction it a lot easier. So that's the first plug. We've got a more second medial plug in the ear canal here. You can see all that hair attached to it. So just some soft wax at the entrance and the roof, and then when we enter the ear, you see again, eardrums are quite cloudy. So I'm just using the suction probe just to gently suction some of this keratin wax off the anterior canal wall of the ear canal near the entrance, so it's quite lateral. So we know we're quite lateral because we can see all the hairs. The hairs are only located in the outer third of the ear canal. That's where all the hair follicles are. So the outer third of the ear canal is composed of cartilage, a thicker layer of skin about 1 millimeter in thickness, and they also contain the hair follicles. The inner 2/3 of the ear canal, it's a very thin layer of skin, 0.1 millimeters, adhered tightly to just bone. There's no cartilage there, there's no fatty tissue. So that's the remnants of the patient's ear. You can see the different shades of brown. The darker brown means the wax has been in the ear for longer, it's oxidized. The lighter brown, it's the more fresher secreted wax. And I managed to weigh that, so it's 393 milligrams, so just under half a gram. I hope you enjoyed that video, guys, and you're all having a great Good Friday. Enjoy your Easter break, and I shall upload some more videos during the weekend and early next week. Take care, bye.